Hi, this is Dr. Laura Phan, and I do oculofacial plastic surgery in Saratoga, California. We recently started a series of what went wrong, and we did one on ptosis repair for our episode 1. And if you have seen it, you might recall that it was a gentleman who had 2 previous ptosis repair on the right and 3 repair on the left and still had residual ptosis. During my surgery, which would be repair number 3 on the right, repair number 4 on the left, I noticed that the suture was in the wrong plane on the right. It wasn't even tightening the muscle, it was tightening the fat. And then on the left-hand side, the sutures were not placed high enough into the muscle to really tighten that weak muscle. The problem there is just, part of it is, yes, the muscles are weak and the left one is weaker than the right, but majority of the problem there was the surgery did not correct the muscle weakness because the sutures were placed in the wrong place. So follow-up for this patient, he came back a week later after surgery. Yesterday was his post-op week 1. And he's thrilled that his eyes are more open. He doesn't look sleepy and tired. He can see more of his eyeball, the blue iris. So look here on my left is the pre-op photo. My right here is the post-op photo from yesterday. This is post-op week 1. The left eye is the weaker eye, so there's still a little bit of asymmetry in where this is the smaller eye here. This being the weaker muscle, I had to do a lot more tightening, put more sutures and tighter sutures on this left side, so there's going to be a little bit more swelling here. Not too much bruising on either side, but just some inflammation mildly, a little bit more on the left as expected, given the amount of advancement we had to do with the sutures. But overall, the results are a lot better than I expected, given the history that I heard from the patient. If we ignore the upper lid and now concentrate on the lower lid, you might notice that our right lower lid is a little bit lower or saggier than the left lower lid. So the side with the lower eyelid will be the side that appears bigger. This right eye is slightly bigger because one is, yes, the upper lid is about 1 millimeter higher, but the lower lid is also at least 1.5 millimeters lower, especially in the lateral half. From the center out, it's a little bit lower than the other side. So we have some horizontal laxity on this side and thus more retraction. I would say we have horizontal laxity on both sides, but more on the right, and therefore more retraction of this lower lid on the right, making this eye the bigger eye. So to mitigate that and improve the asymmetry, I would do a bilateral canthoplasty, tighten the corners up, tighten up the horizontal laxity, tighten up the corner. And if this right side still is more retracted, I would put an Enduragen collagen implant into the eyelid to provide support to push that lid up. Okay? Hopefully that makes sense as to why this ptosis repair is more successful and what can we do to help with the residual asymmetry. Thanks for joining. Bye.